There is a special diagnostic method in cortial hand therapy. That is the abdominal palpation and pulse diagnosis. Abdominal palpation is a method of locating the ailing internal organ by pressing the abdomen. What is the secret behind hand therapy that utilizes such simple diagnostic methods? In Oriental medicine, the symptoms from the disease are first comprehended before alleviating the symptoms. In comparison, cortial hand therapy comprehends the disease based on the theory of five-element acupuncture theory of Master Sa-am and the Qi constitution, as mentioned in the Handbook of Oriental Medicine. The theory of five elements is not to treat the symptoms of the disease that come from the deficiency or excessiveness in the organs, but to control the functions of the organs to treat the disease. In hand therapy, the constitution is first comprehended. Then, according to the constitution, various methods are used to control the functions of the organs. This is the theory of disease as rectified by cortial hand therapy. Then how can we comprehend the disease through the constitution? In cortial hand therapy, there is a method of determining the person's constitution through the date of birth, which is called the Qi constitution. However, constitutions can change. Therefore, the ailing organs are diagnosed by the abdominal palpation method.
How do you feel?
Just pressure.
Just pressure, okay?
I'm waiting for pain, right?
No. If there is any abnormality, then you feel the pain. Now I'm gonna check this side. You discern left from right.
That felt kind of strange. Kind of a quivery feeling.
Right. I gave light pressure, but he reacts sensitively. Now this is first degree pressure, but he reacts sensitively. So you see the difference between right side and left side, right? He had more sensitivity on stomach 25 on right side.
병이 발생하게 되면은 반드시 병의 반사점이 나타나게 됩니다. 그런데 그 병의 반사점이 배꼽을 중심으로 해서 나타나는 겁니다. 배꼽 바로 옆에 복직근이 있는데 그 부위에 긴장이 되는 것은 위장이나 소장, 대장의 병일 당시 나타나게 되고 그 측면 부위는 비장, 췌장의 이상이 있을 당시에 통증반이 나타나게 되고 또 그리고 하복부 부위는 소장, 내지는 자궁 위치가 되기 때문에 거기에서도 통증반이 나타나게 된 것입니다. 이와 같이 내장의 병적 반사를 진찰해가지고 그 사람의 병적인 체질을 진찰하고자 하는 것입니다. 복진할 때에는 세위 위치를 진찰하는 겁니다. 배꼽에서 약 5cm 떨어진 지점, 또 한 8cm 떨어진 지점, 또 그리고 아랫배에서 한 3, 4cm 떨어진 지점, 이렇게 세 군데 진찰하게 되는데 역시 이제 오른쪽에서 약 4cm 되는 지점, 8cm 되는 지점과 아랫배를 진찰하게 된 것입니다. 두둥이 배를 눌러보면 아픈 반응이 없어야 합니다. 만약에 살살 눌러가지고 아픈 저항감, 심한 통증감이 있으면 바로 거기에 병이 있다고 보는 것입니다.
In Oriental medicine, the internal organs are classified into 5 organs and 6 viscera. Then, these 5 organs and 6 viscera are further classified into organs that belong to the yang and organs that belong to the An imbalance in these two classification of organs causes the symptoms of yang excess, excess, and vitality excess.
양실증이라고 하는 것은 소화 기능이 좋지 않다는 뜻입니다. 심장 기능도 또 나쁘다는 뜻입니다. 소화 기능이 안 되고 변비가 생기면은 복직근, 그러니까 배꼽 옆에 부위를 누르면 긴장 상태가 나타나게 된 것입니다. 또 그리고 신실증의 경우에 있어서는 심장이 혈액순환이 안 되게 되는데 이럴 경우는 하복부가 차고 딱딱하게 긴장 상태하게 되고 아파지게 된 것입니다. 바로 이 경우가 이제 신실증이라 하게 된 것이고, 음실증의 경우에 있어서는 주로 비만 환자에게 나타나는 반사점입니다. 비만 환자들은 복부에 아픈 통증이 거의 안 나타납니다. 측복 부위에서 반사점이 나타나게 된 것입니다. 그걸 보고서 이제 음실증 이렇게 진찰하게 되는 것입니다.
After determining the state of the organs to find a more clear cause of the disease, the Yang pulse diagnosis is used. This is a method of diagnosis using the submental artery under the chin and ulnar artery in the wrist. If the pulse of these two arteries are the same, then the person is healthy. But if there is a difference, then this is a sign that there is an illness. A specialist who has studied the Yang pulse diagnosis for a long time can determine the accurate cause of the illness. If we were to seek the basis of scientific support for the Yang pulse diagnosis theory from modern medicine, then that would be the variation of hemokinetic volume. In a healthy person, the blood would flow consistently through the blood vessel, and the body will be in stable condition, which the Koryohan therapy speaks of as being healthy. However, when a deviation in the hemokinetic volume occurs, then this indicates a red signal in health. The research on hemokinetic volume, which supports the Yang pulse diagnosis theory, was surprisingly started by a neurologist studying Western medicine. He utilized the hemokinetic volume changes, which is usually used to observe cerebral vascular disorders in the Koryohan therapy.
경동맥 왼쪽 편.
And he is in the process of revealing that there is a close relation between the changes in the hemokinetic volume and the health condition of all the organs in the body, not only the brain. If a disorder in the body function is revealed through the abdominal palpation method and the pulse diagnosis, then not only the hand therapy but also therapeutic bracelets, rings, and other therapies are performed simultaneously. By stimulating the hand with the appropriate equipment according to the symptoms and disease, we can expect a faster treatment effect. Hand therapy should not be underestimated as something that assists the blood circulation by simply applying acupuncture to the palm. In Koryohan therapy, there is a profound theory and prescription in viewing the disease, such as Yang pulse diagnosis and abdominal palpation method. As a result, the mystery of hand therapy, which is receiving much attention as an alternative source of medicine, is popular and effective.